One of the major problems with colorectal cancer is that, in the early stages, anyway, there are often no obvious signs or symptoms. That's why it's so important to take advantage of screening exams, like colonoscopy, that can find and remove polyps, the small clumps of cells that form on the lining of the colon, before they can develop into cancer. Frequently, it's not until the disease has grown into late-stage cancer or spread to other parts of the body that signs and symptoms of it appear. Take charge of your health this year with the 2017 Prevention Calendar and Health Planner. Order your copy today, although they can vary. The most common of these are fatigue. This is the symptom we see most often, says Jimmy Huang, MD, head of the GI Medical Oncology section of Carolina's healthcare system in Charlotte, North Carolina. That's because polyps or tumors can slowly bleed into the digestive tract. Over time, this bleeding robs your body of red blood cells and the iron needed to carry oxygen to your body. The result, iron deficiency anemia, which can make you feel tired and short of breath. It's not unusual for the first sign of colorectal cancer to be a blood test showing a low red blood cell count. Rectal bleeding. There are lots of reasons you may spot blood in the toilet or on some toilet paper. It may be a sign of a benign condition like hemorrhoids or a small, self-healing anal tear. But it can also signal the presence of polyps or cancer. In fact, many colon and rectal cancer patients initially think they have hemorrhoids because of rectal bleeding or itching. If you're experiencing rectal bleeding, see your doctor, especially if it's a new symptom. Bloody poop. Blood can show up as red streaks or make poop appear very dark or tarry looking, indicating the presence of dried blood. If you notice blood in or on your poop on a recurring basis, have it checked out. Unusual bowel habits. Polyps and tumors may change the consistency, shape, or frequency of bowel movements. For instance, narrow pencil-like stools can occur when cancer obstructs the intestine, explains Huang. Constipation, usually defined as going 3 times or less a week, diarrhea, which means having more liquid, bowel movements than usual, or feeling like your bowels aren't emptying completely when you go to the bathroom are other possible signs of colorectal cancer. Consult your doctor if they continue for more than a week or so. Belly pain. Tenderness, cramping, nausea, or vomiting, which can be signs that a large polyp is partially obstructing your bowel or that the cancer has spread beyond the intestine, should be reported to your doctor.